part of the money from the Hitec Act went into funding this concept called a regional extension center. And in New Jersey, they filed a grant through the New Jersey Institute of Technology. It was a $23 million grant that NJIT got to support the implementation of electronic health records within the state of New Jersey. Now, the real focus of the RECs, as they're called, is for primary care providers, because they saw the biggest need to help for electronic health record systems is for primary care providers. So their real focus is on primary care, and their stated goal is to try and help 5,000 primary care providers in the state of New Jersey implement electronic health record systems. So as their mission and charter became clearer through 2009 and 2010, we began a dialogue with NJ Hitec, and subsequently we've become field representatives for them in central New Jersey. So now we communicate directly and frequently with the folks at NJ Hitec with their information and programs, and we really are the delivery mechanism for them down here in central New Jersey. Their team, which is kind of interesting to work with, they've got a lot of professors on board, and if anybody's ever worked with an academic environment, it's a little bit different than a business or a professional environment, so they're a little fun to work with, but they do put together some good tools, and they are a very good conduit of information directly from the Office of the National Coordinator. So going back to 2009, the law passed, and somebody had to write all the regulations for the law. Well, that landed in the Health and Human Services in the Office of the National Coordinator for Health IT Services. Dr. Blumenthal is the head of that department, and they began to put together all the documentation and information for things like meaningful use and certified systems. That information gets filtered through the NJ Hitec organization, and then we get the most current information from them. The big action right now is trying to figure out what exactly meaningful use means. Working with NJ Hitec is a membership program. Okay? This year it's free. So if you're a doctor and you wanted to tap into NJ Hitec for information and their consulting services, it's free this year, and next year it becomes $500 for a particular location, regardless of the number of providers. So, again, it's really heavily subsidized by the federal dollars that they got. The real charter is to try to identify doctors that need help and then provide those support services for them. And we are the local representatives for them.